Hello everyone, this is Ru. I chose the following article as my rapid fire presentation topic. As a background, the common ACL injury mechanism is altered neuromuscular strategies in movement and that cause change in frontal plane lower limb control such as knee valgus. Then that increase the risk of ACL injury. In the previous study, they used 3D analysis of DVJ landing, and they predicted the risk factors for ACL injury, such as excessive frontal plane knee angle. And also, they conducted augmented feedback and succeeded in decrease in ACL injury risk factors. However, the method they use is not clinically applicable. So in this study, they used 2D analysis of tack jump argument feedback. The purpose of this study is to determine the effectiveness of augmented feedback for clinically applicable exercise protocols in decreasing the risk factors of ACL injury. The hypothesis is FPKA during DVJ will decrease in participants who experienced AF for tack jump during off-season training. The participants are 34 female high school soccer players. The exclusion criteria was history of ACL injury. And they randomly assigned into two groups, first tack jump group and second running on the treadmill group as a control group. And as a procedure, researchers obtain baseline FPKA and participants followed 7 weeks of season training, and again, researchers obtain post-FPKA. Only difference between two groups are in AF group, they obtain augmented feedback during tack jump, and in the control group, they obtain augmented feedback during running on the treadmill. This shows the 10-point scale for in AF group. And also they classified into 6 dominance. Ligament dominance means there's no control in knee valgus. In quad dominance means imbalance in knee flexors and extensors. Leg dominance means imbalance in both extremities. Trunk dominance means imbalance between force demands and core strengths. Technique demands dominance means they couldn't maintain tack jump for 10 seconds. Measurement of FPKA conducted by 3 times of DVJ. They used 21.5-inch box, and then they put measurement onto greater trochanter between right and left epicondyle and between right and left malleoli. Then compare difference in A and B, which you can see in figure 1. As a result, there was no significant difference between pre and post between group in average FPKA. However, there was significant difference between group in pre and post in extreme FPKA. As this shows the raw data for the result. As additional findings, they figured ligament dominance is the most common deficit in initial phase, but quad dominance was most common in middle phase, and the deficits eventually distributed equally at the end. For the implication, application of camera and 10-point scale for tack jump could be applicable. However, videos for minors could be controversial, and 10-point scale could be too complicated to use. However, tack jump could be alternative method for squat. And as summary, AF for tack jump is used in ACL injury prevention. You could use mirrors as alternative, especially for using minors. And if you want to use cameras in 10-point scale, you could conduct during physicals, which we usually conduct during every season. Thank you.